We have support. Any discussion? Seeing none, all in favor with an eye?
Aye.
All opposed, the same. Motion passes. We are back into open session. We have minutes before us.
Wait a minute, Commissioner, those would be underneath item 8.
Item 8, okay. Oh, okay. All right, moving on. Health officers report. It's Rebecca Burns.
Good morning.
Good morning.
So I included a lot of information today for you that I'm not really going to go through. I'll just talk about it really quickly. But let's start with employee recognitions. So pleased to recognize the staff members who have milestone years of employment today. For 5 years, we want to recognize Amy Elkins Little, who is a breastfeeding peer in Hillsdale County. Lori Hibbs, a clinic clerk tech in St. Joseph County. Barb Keith, an environmental health sanitarian in St. Joseph County. And finally, Laura Sutter for 25 years as the director of the area agency.
Started when she was 12.
Received. Yes. So very pleased to be able to recognize those staff members. The CDC infrastructure grant, just to give you a little bit of an update, we are continuing to make some progress with the upgrades that I had mentioned before. So you will notice today, if you haven't already, when you leave, please look that the water bottle fill stations are now installed here in this building. They've also been installed in the other 2 buildings. So that has been completed. And also today in your packet is a carpet bid for Hillsdale that was recommended by the finance committee.
Carpet or the paint?
I'm sorry, it's paint. I said carpet and white. I even typed carpet. You are correct. It is paint. All right, our staffing update. I wanted to thank you for approval of the staffing plan at the last Board of Health meeting. I wanted to give you an update. So environmental health, the EH supervisor position was filled internally by James Young, senior sanitarian with the health department. That left his position open and in Hillsdale County, and there's been a conditional offer pending successful pre-employment screenings of that person. So we're making progress. The new Coldwater EH sanitarian position was reposted.
And Becky, just to update that, the conditional offer,
Is now a real offer?
yeah, she'll be starting on, the 12th of
Yeah.
It's not even an offer. It's actually
Yeah.
See what happens in a week? Woohoo! Great. Alex's position was posted internally for health education and promotion supervisor and filled by Chris Dewey, who joins us today.
All right, Chris.
Chris was previously our emergency preparedness coordinator, which of course now leaves that job open. Our personal health and disease prevention. Kaylee talks about it a little bit today in her report, but I did want to report that Callie is moving on to Barry Eaton District Health Department and leaving us on February 2nd.
We will not accept that as a board.
Yeah.
Yeah, I think we got that, yeah. Oh, well, let me see. Yeah.
Yes, we are sad to see Kelly go, but want to wish her well as she moves on and has new challenges. And it's not, every health department's different, so it will be different and it will be a challenge. Our new nurse position in St. Joseph County, also a conditional offer. I don't know if you know if that one's moved beyond conditional.
Yes,
Yep.
I think she starts next week.
All right, so making progress there. And our part-time nurse position's been reposted. In administrative services, the human resource support specialist position is posted, currently accepting applicants. And reporting to the health officer, the emergency preparedness coordinator position is posted. We've been interviewing candidates. I'm hoping to wrap that up by the end of this week and have a conditional offer out there. And our director, Kelly's position is currently posted. It was not posted when I typed this, it is now. So making some progress there. Request by MCDC today as a part of our agenda. MCDC has requested an update or amendment to our agreements with them. They had hoped to be here today, but the individual, Kim Singh, that would have come is not well. So she is not here because she needs to be home. But the current agreements provide for the opportunity for MCDC to provide an education and outreach payment to the agency. Based on the number of chairs in our Sturgis and our Coldwater centers. So this is just related to those 2 units. And that amounts to $2,000 per chair annually. The MCDC model continues to be challenging for them. They are trying to run that business without, obviously in the black with no negative or in the reds. But they are struggling, and they have come to us and said, we want to update our agreement so that the educational and outreach payments can be talked about every year, but they aren't necessarily a given or a gift. And that is predicated on the fact that, and I've got some budget papers here that you can look at, they are running in the red in the centers. And it is, I will hand these out. These are, yep. Are the end of December unaudited reports from MCDC that if you look down at the very bottom of the page, each page is a different center, but we can start with Coldwater. There's a profit and loss down there. And if you look at the December year-to-date budget, which is the second column over from the right.
Dr. Drill.
Yeah, I know. Yeah, they're really slow. But there are more copies. We can hand out more, but they are running in the road. So if you look at Hillsdale, Sturgis, they're all running in negative numbers, some more so than others. The education and outreach payments that we receive from them, we put them in the budget and frankly have struggled to really expend those based on how our staff needs to put in time to draw down off different grants. And we don't do currently any exclusive MCDC marketing. We, include them in our general, dental health is important and everything should take care. So what I have indicated in here is that we will not do any exclusive MCDC dental outreach when they stop sending us these funds. We will not do that anymore. We will continue to make referrals like we always have and always will, but no more exclusive outreach. If we need materials from them, they will pay for them. They will send them to us.
Don't we have fund balance for that we will still have to do some to use up that fund balance on that?
We can utilize that money that's in the fund balance to do that type of outreach to our clients when they're in the clinics. So we'll help support some of the other programs that they're doing outreach during. So for example, if they're seeing a client about WIC, but they notice that the child has dental needs, then they can do that outreach at that time.
Mr. Chairman, I have a question to the health officer. What's the total amount they are asking for, please?
They're not asking for anything. They're just saying that we won't any longer pay you the $2,000 per chair.
That's
The total is $24,000.
total for all areas, all three.
No, that would be just for the two locations.
Sturgis and Coldwater.
And we'll get into that more probably underneath new business as well, because that's where that will come up. But yeah, that it's, the Coldwater location would be $12,000 a year, and the Sturgis location at $12,000 a year.
Thank you, and thank you for that clarification. One more, Mr. Chairman. Number two, he said anybody in MCDC can give us a little information.
It's in your packet, I think. Or was it, maybe it's just
In person?
Not,
She wished to be here today, but she is sick,
I'm so sorry.
so she was not able to it.
So $24,000 a year we will be
We will no longer receive that.
receiving.
Mhm.
Nice. Okay, thank you so much.
I just want to make sure that you guys hear, though, that these centers are not running in the black. And the funds that they send us, you know, we will take a different stance on that. It is important to me that we continue to offer Medicaid dental services. If you are an individual on Medicaid dental, it is almost impossible to find someone that will take you and provide dental care. So you end up with no care. And poor dental care results in other medical issues. So if you have bad teeth, then you're going to have other medical issues that arise because of that. Okay? So it's important that we keep these centers here, that we keep them whole, and that, that they figure out a way to operate it in the black.
And right now, currently, we are subsidizing this.
So we take in those funds, we have been putting them in the budget, but not always able, most of the time, not able to spend them. As Commissioner Leininger pointed out. And so there is money sitting out there that we have yet to spend on. And so what I'm saying is, we can stop receiving these payments, we can agree to this change. They're still willing to talk to us on an annual basis. And they will provide all of the materials that we might need on their dime that we can use for educational purposes.
and they're still renting this space from,
We are still renting, we get
So-
rent dollars.
Mr. Chair,
Yes, sir.
just a clarification, I know we will be addressing that issue further, but Commissioner Leininger mentioned about their renting. Who owns that for the public clarification?
the Sturgis building.
No, the
The Hillsdale building is owned by the county,
It's owned by the county.
but the building is leased from the county to the health agency. And that was done, Commissioner, when you were on the board in December of 2020. That new lease was agreed to between the county and the health agency. That lease requires the health agency to maintain the building. Okay, and the county gets paid $1 a year rent.
Just because I have been getting emails. Was not going to talk about that this time. You're welcome. And
Yep, the building is owned.
yeah, the who really owns all kind of things. That's why I asked the officer,
It's owned by the county of Hillsdale.
county of Hillsdale. I want to
Absolutely.
make sure that.
Yeah.
Thank you for both the
You
clarification.
know, that, we tried to get that deal done here in Branch County.
Yeah.
That we have in Hillsdale and Three Rivers in St. Joseph County. To save the health agency money and not pay the county, you know, the $70,000-$80,000 a year that we pay the county for rent, and then have to pay 60% of the maintenance on this building.
All right, thank you.
Very good. Go ahead, Ups.
Oh, okay, so Medicare billing revalidation. So every 5 years, we have to go through a revalidation process with Medicare for billing purposes, and I'm pleased to report that that has been completed and we are good for another 5 years. Huge thank you to Teresa and her team for getting that done. The kindergarten oral health assessment is a fairly recent program in the state of Michigan, which looks to have every kindergartner get an oral health screening prior to entering kindergarten or first grade. And there is an opportunity for the agency to accept a planning grant for this fiscal year. We are going to accept that and look at the feasibility of running the program in the Tri-County area. The allocation is $63,059. I do not expect we will expend that. Most of that will go back to MDHHS at the end of the fiscal year. But it does give us some dollars to put into staff time to look at feasibility. Agreement with Hillsdale Hospital, nothing new there on the ban. Couple of public health concerns, wanted to mention a bill package on lead that's currently working its way through the state legislature. Bill package seeks to lower the elevated lead level or actionable level of lead from 10 parts per billion to 3.5, among other things. So that's good, it's protective, but it may cause more work for our that oversight of the children, the case management of the cases. Respiratory illnesses, I'm including some information today, and that's what all this is, regarding the current data with regards to COVID, influenza, and RSV. You can look at that at your leisure, and certainly we're in the midst of flu season and the other respiratory diseases as well. The Mouth Day at the Capitol, the annual event is scheduled for April 10th. I will be requesting appointments with our local senators and representatives on that day. If you're interested in joining me, please let me know. Cold water, so just some updates on what's going on. The cold water office, I mentioned the drinking fountains, and the restroom remodels are going to start soon, I believe. They've got a day when they're gonna bring some bidders through to take a look, so that they can actually do a bid. And so we're looking like we're making some progress. I'm pleased about that. And the Schindler Elevator Company has communicated that elevator work will occur in March of 24. And you have the painting bid for today. And finally, the other resource that I provided today is this one, resources for those new to public health, which is just another resource put together by our Michigan Association for Public Health. It complements the local, the program for public health for local governing entities. This is just a really quick snapshot. I wanted to let you know that this is out there, it's available, and we can certainly share it widely. All right. I think that's all I have.
Very good. Well, we appreciate the report. Any questions for Ms. Rebecca Burns? Go ahead, Mr. Manis.
Chairman, thank you. The director, rather, the health officer, Ms. Burns, indicated that Director of Personnel Health and Disease Prevention Director, Ms. Kelly Nichols, is going to leave for North. I think many of us are going to North, I believe. Mr. Chairman, I want to thank her personally for all the work she has been doing. Appreciate it. I wonder, you have mentioned it is internally, you have already posted.
It is posted, yes.
Any press release for the?
I believe it's posted on Indeed. I mean, for Kelly.
Yeah.
We are having a party for her on February 1st here.
Do you have a party?
Just kind of a like lunch dessert party.
Yeah.
Dessert party.
I didn't check the mail box.
I'm surprised you didn't smell it. Mentioned dessert.
First, 12:30.
I don't remember.
I think it's 12:30. If you're welcome to come.
Where is it going to be, Mr. Chair?
Right here.
Right here?
Right here. Yeah.
Well, you will remind us,
I will.
please.
I will.
Mr. Chairman, if I may add, we really appreciate, maybe someday she will be back here.
She never
Thank you. I appreciate that.
We have friends at Eden and Barry area, so I'll tell them that you are coming. The place will be wonderful. Everybody, thank you, Mr. Chair.
Thank you. Any other questions or comments for Mr. Rebecca Burns? All right, seeing none, we'll move on to the medical director's report.
So my report is in your packet. I think highlights of the month were
Well, one that I only have one more class left in the spring,
Congratulations.
and that starts next week, so, and then I'll be finished with my master's of public health. And, the fact that last month we had appointments with 4 latent tuberculosis patients, and we have 1 active tuberculosis patient as well. So, keeping busy in that regard. I've got there's a little work group with our physician, public health group working on that. We're not the only people seeing it. We're not the only people, recognizing the fact that we have much more exposure to tuberculosis, many more people coming in with different disease processes. So there are some work groups. So I'm involved in the tuberculosis work group just to kind of keep updated. So, but it's also, again, as I've said before, lots and lots of work for our staff here because those medications have to be directly observed. In fact, the active tuberculosis patient has had some trouble getting labs and trouble getting sputums and trouble getting to and from places. He has no insurance. He really doesn't have a good support system. And he's a young guy. So we're actually going to his house to draw blood or transporting him places. We're really trying to help him. So it is a lot of work on the staff. And then we also put out with Chris's help and her department, the latest issue of News and Views. So the providers in all of our counties get a News and Views newsletter every quarter. I do a little piece, and then there's some articles, there's some links to continuing medical education, which the providers appreciate. And this month we put in a little link to ask if they want to do a monthly, very informal kind of fireside chat with me. So I've made contact with all the medical directors of the hospitals and some of the hospitalists, and we're going to try to form a little monthly group. Just what's going on in your area, what are you seeing, what can we help you with, and to be able to offer some of our resources as well. So sometimes there's a big disconnect there. And as much as we put out, they have no idea that they should call here with questions. And so I'm also getting a number here as well that will also, if I don't answer right away, it will go to my email and I can see the calls, which is a good thing, I think. My educational piece, so probably right after the board meeting last month, I started noticing lots of what I thought was seasonal affective disorder in most of my patients and their parents. And so I was going to do a little piece on seasonal affective disorder, and I was chatting with a friend who's a family practice provider, and she said, I try to do more on wellness than I do on seasonal affective disorder. So I thought about that. And I was actually surprised last week. I was talk about wellness. I was in a meeting in Hawaii, so that helped my wellness greatly. But I was telling the group that the meetings start at 6:30 and they're done by 1, which is just perfect because you're up at 3 o'clock in the morning because of the time difference. So you can do your meeting from 6:30 to 1, and then your whole afternoon is free. So that was wellness in 1 week. But at the meeting, they actually did a section on wellness for providers and for your office staff. So it's kind of a buzzword. And most of the wellness at my meeting was physical wellness, things you could do to eat better and exercise better. And so when I started looking the week before that, I actually found this little wellness institute. I didn't love everything on their website, but they did this nice little circle, and it included physical wellness, mental wellness, emotional, spiritual, social, and environmental. I'm not sure about the fostering positive interrelationships between planetary health under the environmental wellness, but maybe for some people. So I thought we need to recognize that it is a whole package, right? So we can have somebody who looks physically really well, but emotionally or spiritually they might be struggling. So I tried to look up some ways that we could all help our wellness, and there were lots of public health things involved in this. And I won't read all of what I came up with, but there were some things that really made me think, and I put them on my list, right? So schedule your wellness check, find a doctor, find a provider, schedule your wellness check. Get an eye exam might be self-serving, but after an eye exam, and we talked about eye health, essential health frequently in those wellness things. Challenge yourself. And some of these sites were very good about challenging yourself to eat like 1 fruit or vegetable with each meal and try it for a week. Give yourself a short term and then try it again
following week, and then all of a sudden it becomes a little bit more of a habit, right? You start thinking about your fruits and vegetables while you're shopping. There was, again, schedule yourself to drink water, give up your soft drinks, go a week without eating fast food, which is it's hard for some families. Update your important medical documents, kind of get your list of medications so that when you see providers or visit is smoother. You could talk about side effects of your medication. There were a lot, try something new. So, you know, I kind of added that to my list of things to do. And they did things like join a book club or join a group of people that you want to chat with every week, or go to coffee with somebody, or call a relative that you haven't talked to in a while. And then opt out of something that's bringing you down. So I just had this conversation with my brother yesterday. And, you know, I don't know, the older I get, the easier that is for me when something's bringing me down. I just move on from it, right? I don't spend a lot of time agonizing over it as I did when I was a little bit younger. Bring your nutritious lunch to work, kind of pack it, let other people see what you're doing, you know, give them advice on meals. Ask your doctor to look at your cholesterol, your blood pressure, do all of your preventive things. So schedule your mammogram, schedule again your well check. Maybe take a CPR or first aid class so that you're prepared to help other people if needed. Take inventory of all your health insurance. Develop one new stress buster. So, you know, maybe instead of a bowl of ice cream, you kind of try a new fruit. So when my kids were little, my daughter was just chatting about this. We did a fruit of the week club, and we went to the supermarket and they got to pick a little piece of fruit that we had never tried at our house. And it kind of went over really well. So it made them try new things, and it made us realize what we liked and didn't like. And they would sometimes add that to their little lunch for school, and then show other kids that they had a star fruit or something else that wasn't kind of common in our area. Get a handle on your medical history, your family medical history as well. Try new ideas for dealing with chronic illnesses and a recovery process. And I liked this one, take stock of your refrigerator and your pantry. So we have a really big pantry in our house. And so it varies when our kids come home, there's different foods in there. And sometimes I look and quite embarrassingly, things are expired. So, you know, take note of that and get rid of things that are expired, not expired, and you're not going to use them. Maybe donate them to a food pantry. And I liked this one too, buy a set of hand weights. So I did that, and I have a little set at my office now. We have a kind of a nice home gym, but I stuck a set at the office, and so now all the ladies in the office are walking around in between patients, kind of doing their little hand weights too. But it's fun, and they encourage one another, so it's been good. Oh, this one's good for Laura. Check your sunscreen for expiration dates. So when I went to Hawaii, I looked at that and I thought, well, I need all these sunscreen. Washing hands regularly. And I also liked challenge yourself to get up 30 minutes earlier every morning and do something for yourself. And maybe that's physical exercise. Maybe it's just having a quiet cup of tea. Maybe it's reading a little bit, or some other things that you might like. So, and there's lots of things. You can look online and there's a million suggestions on how to benefit your own wellness. And again, you know, when we're well, we can help other people better also. So sometimes we talk about that at our house, how it feels a little yeah, when I haven't seen my husband, and maybe we eat dinner and then we're kind of looking at each other like, who's going to head downstairs first and get on the bed in this weather, because you can't take a walk outside together anymore. So we kind of agreed to say that that's not selfish, right? That's kind of helping ourselves, which is going to help our relationship and help us with our family and other people. So I would just challenge you to maybe look up a list of wellness things and pick a couple and start small. And I was reading about establishing habits, and kind of the consensus is, 2-3 months before a habit becomes part of your regular routine. So it's kind of a long time, but if you do it little by little, like some of these things, just do a week at a time, you'll be surprised by how many things kind of enter your life and stay, how many good things. So just encourage you to pick a few of those and start our year off with some good wellness.
Very good. We appreciate that update. It's always good. It's always challenging. It's always good. I appreciate it. Any questions for Dr. Okoro? So I got two things out of that. I'm opting out of getting my cholesterol checked. And who knew sunscreen had expiration?
The expiration.
I did not know that, so that's new. I'm sorry, I did not know that. Now I do though, so I feel better coming out
What
of this.
sunscreen?
Might have been your last
What
sunburn.
sunscreen?
Yeah, with sunscreen. Very good.
If you
Well,
don't get outside, you don't need it,
we
right?
appreciate that.
That's right.
Awesome. Okay, moving on to departmental reports. Mr. Paul, how are you, sir?
Good.
Give us an update on environmental health.
Thank you.
Yeah.
I wanted to give, Becky gave, update on staff. I wanted to just follow up with that just a little bit. And again, I wanted to thank the board for approving those new positions, but very much appreciated. As Becky said, we promoted internally for the supervisor position. James Young has taken that and he is running with it, doing really good. So, appreciate that. We have made the final offer for the position that would backfill James's position. And actually just today, we identified another person for the position, sanitarian position for here at Coldwater. And we have an interview set up next Tuesday. So we're speaking about that. It's been difficult finding qualified people. Had a lot of applicants, not too many qualified. The one that we have is very highly qualified. Young person, fairly wasn't out of school. So I'm really optimistic about that as well. So once again, thank you for that opportunity to get some more people hired in here and helping our staff. But my staff has expressed gratitude towards that too, that we're getting more help on. Thank you. I did want to talk about a couple of things related to PFAS. So in Branch County, there's a mobile home park, Countryside Mobile Home Park, that is actually they're on a well, but it's considered a type 1 supply because it serves so many people. And we do not regulate type 1 water supplies. We do type 2, type 3 are private. So type 1 is regulated by Eagle. We aren't involved in that, but they can keep us in the loop as to what's going on there. So they've had a PFAS that was tested in their well, and they have decided that they want to go in the area adjacent to that mobile home park into some residential wells and do some sampling to see if there's any more PFAS out there. They contacted me to see if we'd be willing to collect some samples for them, and I said yes, we would be glad to help you, but we need to be compensated. You know, this isn't our program. We have a long-term monitoring process that we work with Eagle on that. Been working with Eagle to take samples from areas of known contamination, and there's a process where they pay us so much per sample and for mailing and those sorts of things to cover our costs. So unfortunately, they came back and said, no, I'm going to be able to pay you, which I mean, I'm happy to help, but if we're not going to get paid for it, we're not going to be able to do that. So they're going to be sampling, those homes. I think they've identified 5 so far that they want to sample. So obviously, if they find some PFAS chemicals in those wells, we would then be involved, like with any other PFAS sites. We'd open that up and we'd be helping the state deal with that. And if they need to have filters, we would be in charge of that. But at this point, it's just still in their hands, and I will keep you appraised as those samples come back. There really is no timetable yet that they've indicated when those samples will be done. But as that information comes to me, I will pass that along to the board. Yeah.
Where is that at?
It's just south of Coldwater.
Yeah.
Just a little ways south of Coldwater.
I have a question.
Sure. Go.
Is it within a mile radius of that area, any factories there?
I'm not sure about that, Tom. The initial PFAS, they're thinking there was a dump site out there, not too far from there, years back. And when that first came up, that was kind of the talk, and I don't really have that much information on it. Like I said, that's really kind of an Eagles ballpark there. We're not too, involved in that at this point, but, yeah, and I guess fortunately, there's not a lot of residential wells around that. So, if they do find some contamination in there, it wouldn't be, we're not looking at a lot of impacts or numbers of homes being impacted by that, at least at this point.
Sure.
So, the other thing I wanted to talk about is, I was contacted, by the residents in Mendon, recently. They had some concerns about some health issues that they were having, and, their home is located very close to the Lear Sigler plant in Mendon, which is one of our PFAS contamination sites. So back in 2020, Eagle conducted a pretty vast sampling. Most of the homes that were sampled were within the village of Mendon, but they did go out into the township, which is where these folks are too, along that area close to the plant. So there were, I don't remember the exact number, but there was quite a few homes that were within the village of Mendon that had PFAS contamination in their well. So, all of those homes have since been, connected to the municipal water supply. So that's a good permanent solution for those. In 2020, when that sampling round was done, there was one home just outside of the village limit that did come back with some PFAS contamination. And, Eagle worked with the village to see if they would extend the water. So again, we're always looking for a permanent solution, not just a filter to be put into a house to rely on that filter. Unfortunately, the village was not interested in extending water into the township. I believe it was a matter of capacity more than anything else. So we have supplied that one single home with PFAS filter and continue to work with that. The folks that were complaining were actually right next door to that. Their home was sampled as well back in 2020 for PFAS, and it was a non-detect. But because of their concerns and contacted Eagle and Michigan Department of Health and Human Services, we had a group chat about this. I kind of told them what was going on, what their concerns are. So they are actually going to move forward and do some more investigation into this area. So again, I don't have a timetable on that, but it's good that they're going to be doing some more sampling, more investigation, and kind of put these people's mind at ease if we can get some sampling done out there. So once again, when those samples come back, I will pass that along to you. So that's really about it there. One last thing that I wanted to talk about is next month, the educational piece for the Board of Health is going to be on the food program. So I'm going to have Joe Fraser, who's one of my supervisors, present that to you. But I wanted to throw out to the board if there are any specific items about the food program that you would like to know about, and we'll make sure that we include that in our presentation. So you don't have to answer me if you want to talk to me today afterwards, or send me an email. If you have something specific about the food inspection program that you'd really like to know more about, just send me a note and we'll make sure that we include that.
Very good. We appreciate that update. Any questions for Mr. Paul?
So will James still be working out of Hillsdale, or will he be,
His home office will still be Hillsdale, but he'll be traveling the 3 counties.
okay? And
He'll be
so,
visiting all the offices as much as I do. And Joe was her other supervisor, traveled to all the different offices.
and so the replacement for James will be housed in Hillsdale as well?
Correct.
And I just want to remind everybody that one of the reasons why I was in favor of hiring extra set more for EH is because, our residents are needing their services. And if we can open capacity for those services, it's good for our restaurants, it's good for those building homes and well inspections and everything else. So it's a win-win for everybody, which we appreciate.
Are we fully implemented with the new software now?
Yes, not quite. The only thing that we don't have is the portal. So, but as far as functionality within, running all the programs for our people, we are at full capacity there, and that's going actually quite well. And so we're still working on getting the portal set up, will allow people to, apply for permits and such right online, not having to come into the office. They'll be able to look up some of the, see if we have, documentation on, wells and septics. So we're looking forward to having that implemented as well. That will really save our clerks a lot of time. They get calls all the time. Hey, you have anything on this property? Or, I want to apply for this permit. They can just go onto the portal. They can log on. They can make their payments. They don't have to come into our office. The clerk can take time, and it's fine. They can still do that, but there's another option, and I think it'll be utilized by a lot of people, especially the contract, the well and septic contractor. Instead of having to drive down to one of our offices and fill out paperwork, they can actually just sit at their desk in our office and take care of that, send it in, and it's going to be more efficient for them as well.
Very good. Well, we appreciate that. Any other questions? All right, moving on. Miss Laura with Area Agency on Aging. Welcome.
Good morning, thank you. So I included the first quarter services to victims of elder abuse report for your perusal. It was a quiet quarter, so staff really tried to engage more in webinars and online trainings to stay brushed up on some hot topics in their field. We obviously been keeping busy with referrals and talking with and coordinating with our community living program on some shared participants who may also qualify for the Victim of Crime Grant. The Commission on Aging here in Brant County did start their first day of congregate meal service at the Union City Senior Center. It was a very, they had a delay because of the weather, so their initial day changed to Thursday, January 18th, and they had 12 people. And so they're hoping that, continuing on with this mild weather might bring more participants, but feedback has been positive so far. Becky Schuler is our new nurse care consultant with the Community Living Program. She started just after the new year and is off and running. She was not able to be here today. They have meetings scheduled, but he's definitely a quick learn and is very kind, calm. I've observed and listened in already, so we're hoping that she likes her as much as she likes us as much as we like her. So with the end of the fiscal year comes a lot of reporting and a lot of compilation of data. Our team has closed out 2023 programmatically, and now the Bureau is in their final processes of closing the financial side of things. So that's just ongoing, and things are looking good there. The Commission on Services to the Aging at their December meeting chose to take action to extend a multi-year plan an additional year so that it coincides with the plan that the Bureau submits to the federal government. It will help tremendously. What will happen then, our local contracts would get extended for another year. So it's a good thing to have it all coordinated and all sort of consistent. It will also, we'll still be diligent in looking at the demographic data and some of the other trends that we're seeing among service providers, and address that in our allocations process. We do that every year, but the contract physically will be extended another year as a result of that Bureau change. And the last update there is related to one of our contracted service providers in St. Joe County. Our transit authority there receives around $26,000 in grant funds from the Area Agency on Aging through our Board of Health allocations process. And they're looking at operations and efficiencies within their organization and service provision in general to the county. They do two types of transportation under contract right now. The first is, what we call demand response. So if somebody knows ahead of time, that they need to go to see their, doctor or to across town to schedule the transportation from their home to the place. They do that ahead of time, and it happens with one of their 15 passenger buses. They can take a caregiver if they need to, and it is a donation-based fare. The other type of transportation they do is in a smaller vehicle, still accessible, but it's typically for used a lot for out of county medical transportation. Some in medical transportation as well, but it's a much more specialized service. But it still fulfills a very strong need. They are the only transportation provider in the county who receives grant funds from us. So they're looking at not only their operations and efficiencies that they have, but they may be seeking a contract amendment. And that would go through our board process. Commissioner Hoffmaster was a part of a meeting recently with their leadership team there, including their finance and operations person and their director. So things are in motion. I don't know if everything will be prepared for the February meeting, but we're thinking about this, and we're offering technical assistance when they need it. And so more to come on that. Are there any questions?
Any questions? Sorry.
I get to do the board education after the
All right.
board health meeting today.
Tom, go ahead. Do you have a
Thank
question?
you. Yeah, thank you, Mr. Chairman. I have only a comment to make. Ms. Sutter's service, 25 years. I was a young boy. So we appreciate her services.
Thank you.
Thank you, Mr.
Yes, and if I can add on to that, Laura, I celebrated 25 years last year as well, so I know.
It's mind blowing, truly.
I surely know what can happen over 25 years.
To see just how everything has evolved, not only in the aging network, but in the public health network, and it's just it's very interesting. And I do believe Ashley joined us. Ashley Ellsworth could be watching online today. She wasn't able to be here due to her workload, but she said it's been
Very good. Well, we do appreciate your service and loyalty to obviously AAA and what you're doing there. I appreciate personally coming to the Transportation Authority. Laura's been awesome in trying to kind of navigate some complicated issues that I'm on that board also, and that we're going through. She's a great partner, and we appreciate what she's doing. St. Joseph County on that regard.
Thank you.
Very good. Okay, moving on. Health education and promotion. Ms. Chris, welcome.
Good morning.
Good morning.
As Becky shared, I have taken the position of Health Education and Promotion Supervisor, currently serving as the Emergency Preparedness Coordinator while we're in transition as well. So I'm going to give you Health Education and Promotion and a little bit about what's happened in EPC in the first half of the year. So you have the report in front of you. Just a couple things to highlight. We are working on developing our work plan for 2024. So I've been meeting with my team and talking about what makes sense for us to identify as projects for this upcoming year. So we've been working on that. We did attend several community events, but as you can imagine, this time of year, community events are a little bit slower. So we were at Winterfest in Hillsdale County, December to Remember in Fullwater. Michigan Works held a resource fair, and we also participated in Toys for Tots in Sturgis. The community health worker program, she's still doing well with the program. We now have the ability as of January 1st to request reimbursement from Medicaid services and providers. And so Rachel and I have been working through that process. We had to go through some processes to get her a billable NPI. Now we need to go through Nightingale Notes and get the documentation system up to code for us to be able to request that reimbursement from Medicaid. So working through that process. You have the data numbers as well. as far as for emergency preparedness, the first 6 months of our grant period has elapsed and we were a very busy agency. We had 4 events for which we did after action reviews and improvement plans. Those included the Three Rivers wastewater discharge into the St. Joe River, the Three Rivers action level exceedance for lead. Lake Diane had a harmful algal bloom that we responded to, and then the BP gas line rupture where we provided support to Eagle and the EPA and the Branch County Emergency Management. We also completed 4 exercises and drill activities. Agency-led drills included fire drills in all of our offices. We did the National RAD Responder Drill, which is for radiation exposure. Our 3 counties are not in high threat for a radiation incident, but we do have a portion of St. Joseph County that does fall within the 50-mile radius of the power plants in Berrien. So if there were to be a radiological event of that type, or if we have a radiological event on one of the main highways in a transportation situation, this drill was to help us to identify how to use some specific software designed to monitor and manage a reception center and processing folks who've been exposed. So we participated in that. We also participated in a Region 1 long-term care, adult foster care drill exercise about evacuation. The program began with folks that took part in the evacuation of the 14-bed adult foster care that was hit by the tornado up in Berry County. And all of those residents were transported to the county long-term care facility. And so they shared some of the challenges of that from a licensing and regulatory perspective, transportation in the middle of the night, that type of thing. And then with Region 5, we participated in the medical response surge exercise. That was a tabletop exercise done with Region 5, 6, 7, and 8. We did receive the special funding dollars from the states, and we have installed the AEDs into every office, replacing the previous AEDs that were older. So that project is done. All staff are in service on the new AED. We also did receive our Stop the Bleed training materials, and currently working with the county emergency managers and medical control authorities to identify opportunities to do training in each county. Again, our goal is to train 100 residents in each county in Stop the Bleed.
Chris,
Yeah.
on that, so the health department has a training program for Stop the Bleed, right?
Yes.
And would you train county staff with that?
Yes, our goal is to train 100 providers in each county. And we're trying to partner with medical control authorities and the emergency managers in each county to provide us with additional trainers to be able to train larger groups of folks.
And you got that through a grant?
Special funding that was provided through the emergency preparedness program at the state level. So at the end of the fiscal year, DEPR, the Department of Emergency Preparedness, offers us opportunity to request special funding. And so we made that request and we received the funding to do the AED.
Was that available just to health departments?
Yes.
Through the emergency preparedness.
Also,
I may want some more information on that.
okay, I'd be happy to provide that. Also this month, we did provide ICS 300, that's an incident command training for advanced level providers in the incident command structure. So for our agency, that looked like supervisors, directors. We had 6 participants. There were 20 participants in the class. We had folks here from Battle Creek, Portage, fire department, law enforcement. So it was a very nice class. I think everybody learned a lot. We will be holding an ICS 400 class, which is the top line incident command class, and that will be February 28th and 29th. So for those who may be watching our board meeting today, there are still seats available. So if you have someone that needs that training, please feel free to enroll.
Very good. We appreciate the update. Chris, any questions? I have a quick question. So I get to serve on another committee with you, obviously, the local emergency planning committee. So I would assume the emergency plan preparedness coordinator, the new coordinator, is going to be able to be on that committee.
Yes, so the intention will be that the person that replaces my role will assume the relation.
That position going forward. Okay.
Yep.
Good.
And we'll continue with the activities.
I miss you on that board. That's always good. So, do a great job. Okay, good. Moving on. Miss Callie, personal health and disease prevention.
Last report to us.
Sad.
It's bittersweet, that's for sure. I appreciate all the well wishes. So I just have a couple of updates for you on respiratory viruses. I know Becky touched on this and has the full flu focus for you in there to take a look at. I did look at some of the updates from that this morning. So respiratory viruses are on the decline, but not out of the woods yet. Flu season is from October to May usually, so it's good to see that that stuff is declining at this point. And Michigan was high, I believe, last week, and this week we're now at moderate. So we are seeing a little bit of a lower activity level in those viruses. And then I did see here that nationally there are now 47 pediatric deaths reported due to influenza. And I had a little typo here in my report, but the last sentence was supposed to say that there are no pediatric deaths currently reported in Michigan. For immunizations, I talked about last month that we were still working on getting RSV vaccine. We now have that in-house that we can administer for age 60 and older and pregnant women. Amanda is our mobile unit RN. She has been working diligently on contacting local facilities, schools, businesses, nursing homes, adult foster care to get some vaccine clinics in. We've recently visited a few of the county jails to vaccinate. She's been to a couple of nursing homes, and then we are expected to, I think, a larger nursing home here in Branch County to give around 60 doses. So she has been busy trying to keep that active. For WIC, I mentioned this last time as well, that the WIC management evaluation is coming up. So they will do our Sturgis and Three Rivers office March 18th to 22nd. Shelby is the clinic supervisor in Hillsdale and the WIC coordinator. She is amazing with the WIC program, really knows the program and is working on making sure that we'll be all set with the management evaluation, and I have complete confidence in her, so that I'm sure that will go smoothly. The staffing update, we mentioned that a little bit as well, and I just wanted to same sentiments as Paul. Thank you for approving those new clinic roles. They are, the RNs are desperately needed here. And I know that will be a huge help in St. Joe County, having the 2 locations, as well as doing some of the CD work that Dr. Ruprell mentioned with TB, because the demographics in Branch County are definitely changing. So, you know, we need use of our translator system, and it's a lot more time consuming appointments. So it will be helpful to have those shortcuts here to work on some of those things. And then lastly, in hearing and vision, the clinic supervisor for that mentioned that she discovered lately that it's becoming difficult, challenge to find eye doctors in the Tri-County area that take Medicaid for eye exams. So just wanted to put that out there, because as potentially could, I don't know, maybe lead to a bigger concern down the road, but we're seeing a lot of difficulties with providers not accepting certain things and insurances and items like that. So just something to kind of keep on the radar for the future. And then of course, like I said, thank you for the well wishes on my departure. I am very grateful for the knowledge and experience that I've learned here, the relationships built. So it's been an honor to serve alongside you and help make these communities a better place. So thank you.
Very good. Thank you. Any questions for Ms. Callan? Comments?
You will be missed.
Thank you. Appreciate it.
Agreed. Thank you for all that you've done. I know I haven't been on the board for a real long time, but you definitely do a wonderful job, and we appreciate that. And we wish you nothing but the best.
Thank you.
But selfishly hope you come back.
Thanks so much.
Yep, very good, very good. Okay, moving on to financial reports. Ms. Teresa.
Yeah, so before you, you have the bills for December. Not a lot here that's unusual. You will notice on the bottom of page 65, Cribs for Kids, that's where we purchase pack and plays for our MCH grant or maternal child health grant to give to folks so that they can provide a safe sleeping environment for their child. Everything else here is pretty routine. Be happy to answer any questions you have.
Commissioner, I would move to approve the December 2020 bill as presented.
Very good. We have a motion on the floor. Do we have support?
Support that.
We have motion and support. Any discussion?
Pay the bills.
Yep. All in favor with an aye? Aye.
Aye.
All opposed, the same. Payments approved. Moving on to review of financials.
Yeah, so before you, you have the balance sheet for December, the cash disbursements that only go through November. Do not have them reports from the county yet, at the time of this publishing. And then the meat and potatoes that you really like to look at are the expense by program. There's a lot going on here. We did make the adjustments of the budget amendment that you approved at the last meeting, which is why you will see a negative number on page 71 for RU 185 and RU 200. That those expenses have been moved into other areas. We've closed those programs out and added those into other areas where they're allowable expenses as well, which will help us. The other thing that's a little bit unusual on these finances is there is a distribution that goes for community health. And the community health services allocation is how we pay for health education time that is used to support the programs. For example, you know, they do the brochures for the agency, they do community events that really tout the whole health department. And those dollars are then, because it's not specific to one program or another when they're doing things that are an agency encompassing, those expenses are transferred to the programs themselves through an allocation. And the way that we have funded health education, we are expending the portion of that that is being transferred to the programs as one funding source initially. So it's showing some of these programs are over because we're choosing to allocate all of the expense at the beginning of the year and then use a different funding source that will allocate the rest of that during the rest of the year. So it looks a little different than what you're used to. We expected this to happen, and it will fall in line on those programs as we move through the year. So I would be happy to answer any questions that you have about the explanations on page 72.
Very good. We appreciate that. Any questions for Ms. Teresa?
I would move to approve the month-end financial statements as presented by the finance director.
We have a motion on the table. Any support?
I support Mr. Chairman.
Okay. We have a motion and support. Any more discussion?
I think, I would appreciate an explanation of ELPHS.
Yeah, so ELPHS stands for Essential Local Public Health Services.
So the programs mandated in the public health code.
Thank you. Very good. Any more questions? All right, we have a motion on the floor. All in favor with an aye? All opposed, the same? Motion carries. On to item number 8, committee reports, Finance Committee. You have the minutes. I actually, yeah, I was the chair.
You're still on?
Yeah. I'm still in the chair. My bad, son. My bad, son. All right, so you have the meeting minutes in front of you. We discussed the, some of the things that are obviously on new business. So we'll get to that. But I would certainly entertain a motion
I'll
to.
move, unless Commissioner Lanius wants to,
Go ahead.
I'll move to approve the finance committee meeting minutes from January 1st.
Very good. We have a motion. We have support. Further discussion? Seeing none. All in favor with an eye? Opposed the same. Motion carries. Item B, program policies and appeals.
All right,
Thank you, Mr. Chairman. I just yield that to our commissioner over here. Thank you.
as the new chair, you can see the minutes of the program policy and appeals committee meeting on January 17th. We talked about the contract amendment with in my community
Dental centers.
dental centers, which will be coming up in new business. That was recommended to the board. We also had a closed session as well, and we'll get to those minutes here in a second. And we discussed briefly the intergovernmental agreement between the tri-counties. That's something that's not on the table today, but will continue to be there and be something that we need to look at because, as you remember, as we discussed last month, that has language in it that terms of appointment from the Board of Commissioners to this body will be for 2 years to commensurate with the term of office for county commissioners. And January 1st of 25, those terms go to 5 years or go to 4 years. So something that we need to address in that joint operating agreement. So I would move to approve the January 17th Board of Health Program Policy and Appeals Committee meeting minutes as presented.
I support, Mr. Chairman.
Very good. We have a motion and support. Any further discussion? All right, we have a motion on the table. All in favor with an eye?
Aye.
Opposed the same. Motion carries. On to, that's B and C, correct?
Yes, well, no, that's B.
That was B.
We now have C, and C is a handout that was given to us just a little bit ago by Teresa.
Oh, okay, yeah.
That's not in the packet. And again,
Gotcha.
those handouts will have to go back to Teresa as soon as we are done with them here. So we have the January 7th, because those must go into a envelope and be held for 1 year and 1 day after today. We had a closed session on the 17th. You can see those minutes there. You can read those. I would move to approve the minutes of the closed session of January 17th, 2024 as presented.
I second.
We have a motion and support for those minutes on January 17th of the Program Policy and Appeals closed session minutes here. Any further discussion? Seeing none, we have a motion on the floor. All in favor with an eye?
Aye.
Opposed the same?
Tom,
You got to hand it
you
back.
have to give that back.
I already do it.
Motion
No,
passes.
no, that
Minutes.
has to go back.
Moving on to item number
This
D,
one,
Yep, the next one,
or letter D.
you could have another one for today.
I already.
This is the January 25th. This is today's closed session minutes. We went into closed session. You have the minutes in front of you. We'll hold on to these for a year and a day. According to Hoyle.
I would move to approve the closed session minutes from today as presented.
We have a motion and support. Further discussion? Seeing none, let's do a vote on the motion. All in favor with an eye?
Aye.
Aye. All opposed the same? Motion carries. Grab those. Very good.
Thank you.
Make sure you hold on to those for a year and a day, Teresa.
Already have it written on tablets.
I'll be calling you. New business, 9A, MCDC agreement, page 77.
I would move to approve the amendment to the MCDC agreement as presented in our packet.
We have a motion by Commissioner Leininger. Do we have support?
I support.
We have support by Commissioner Matthew.
And
Further
Commissioner
discussion?
Putnam.
Yep.
as Becky indicated in her report, this is something that was requested of us by MCDC. We did have a representative from MCDC join us via Zoom at our Program Policy and Field Committee meeting minutes, and she is under the weather and unable to join us today. As you heard before, this amounts to $24,000 that the agency will not be receiving if this is approved. That money, though, was strictly set aside money to use strictly for dental outreach. And I forget, Teresa, how much money do we have in that as far as fund balance?
It's a little over 400,000.
So it's not money that we've been able to really utilize a whole lot of. It's, you know, we were presented those financial statements here a little bit ago from MCDC, and I'm not sure that 12,000 per office is really going to be that substantial of help, you know, looking at those numbers. We'll leave that to the finance expert over here.
No,
But right, it is something that we want to continue to make sure, do what we can to help them. They do still pay us rent for each of those facilities though, so.
very good. We appreciate that. Any further discussion? Seeing none, we'll go ahead and vote on the motion on the favor with an aye. Aye. Oppose the same. Motion carries. Moving on to B, Board of Health bylaws, page 80.
Chairman, I would move to approve the Board of Health bylaws as presented.
We have a motion on the floor. We have a support.
I support Mr. Chair.
Commissioner Math. Very good. We have a motion and support. Discussion.
Commissioner, if I may,
You may.
as a reminder, underneath Article 9 of our bylaws amendments had to be presented in writing at least 10 days prior to the meeting. We were presented with a copy of these amendments at our December meeting with the Board of Health. A reminder, we're just underneath Article 5 meetings, Section 5, we're inserting the word board chairperson. In other words, whoever is the chairperson of the board, he'll be the one to call a special meeting of the board or even of committees. And we are deleting Article 10, county appropriations, because, you know, we at the Board of Health don't determine when the counties make those appropriations. And really that's something that we need to consider adding to that joint operating agreement that we discussed earlier.
Very good. We appreciate that synopsis. Any other further discussion? Seeing none, we'll go ahead and vote on the motion on the floor. All in favor with an aye?
Aye.
All opposed the same. Motion carries. Item letter C, Board of Health contact information updates. I believe that was,
Yeah, so
Teresa has that.
I just wanted to make sure that you did not want any changes on the way things show up on our website for our Board of Health members. The information that is currently there shows the name, and then if you click on them, then you see their email address and the county address. As long as you want no changes, then we are good to go.
As far as I'm concerned, Mr. Chairman, mine is okay as long as not listed my cell phone, because my grandchildren will be picking up.
Yeah, there's no phone numbers on the website, just email address and the county building address.
Do you need any action?
No.
Okay. Everybody's good? I know Teresa brought by that information, so. Moving on to letter D, employee recognition. Ms. Rebecca?
As I mentioned in my report, so we just want to formally recognize those staff members. Thank you.
And you have certificate for the chairperson of the board to sign.
Yes, I do. Thank you,
Oh,
Brent.
boy.
Look at that.
Well, there's not as many as there
Not
were.
as To sign.
Just
Thank
4
you.
little signatures.
I will do that.
That's all.
Can I do that? I can do that. Yes. Okay. Well, congratulations. Longevity is a rare thing right now, and we appreciate your service, and hopefully that continues. It's phenomenal.
Mr. Chairman,
Yes, sir.
you for this longevity, you appreciate it as well as I do. You know,
Yes.
are you serving them dinner or?
As long as I get to partake, yes. We'll do,
He's serving, you're paying.
yeah. Surf and turf.
It will be my honor. I will turn the bills to.
No.
Finance.
They will be promptly declined. Being the chair of the finance. Awesome. Well, thank you for your service. Moving on to E, the interior painting project at Hillsdale. We discussed this in the finance committee meeting. We had a couple bids that the director brought before us. We went through those bids. They're in there. Do you have any more information, Rebecca?
We brought only the bid that you approved
Yeah.
today. This particular company is local to Hillsdale. They were just slightly lower in their bid than the other contractor that submitted. There was a third contractor that I reached out to that never followed through. But I feel confident that this company will do a nice job.
Yep.
Yep.
And this is also coming out of a grant that we
It
received.
is. It's part of that infrastructure.
The infrastructure grant. So
Yep.
we do have the funds to provide for that as well.
Absolutely.
Yep.
I would move to approve the painting contract with Apex Painting as presented.
Very good. We have a motion. Do we have support?
Mr. Chairman,
Sir.
who's that one?
Let's get
Point of order.
a support and then we'll discuss. Yeah.
Okay.
Do we have support? Anybody supporting Commissioner Lanius?
You can.
I can do it too. Hey, I support. Okay. Now discussion.
Thank you,
Go
Mr.
ahead.
Chairman. You have been, the health officer, Mr. Chairman, mentioned that the second party, who is that party and who is the first party? The name
The third party commissioner
I'm referring to.
is
I'm
Apex Painting. That's the business.
Mhm.
Right.
Who was the, I watched the finance committee meeting and
I'm
I
pulling
looked
it
at-
right now. It's
Just a
NNP or
clarification,
NNL or
N and L.
NNL.
Copy of
There we
it.
go. It is in the board packet.
It
It
is?
was
I don't know.
not in that packet.
it was in the finance committee meeting
Oh,
packet online, Commissioner.
It's right here, Commissioner.
you know the name?
It's online. It's NNL Paint Company.
What's that?
N&L Painting Company out of Jonesville
From
was
Jones.
the other bidder.
Is
That's
he
the-
or she came to see you? You have
both of these contractors that I received bids from met with me at the Hillsdale office. We walked around the building. And then, they submitted bids.
How much is this company from the Jones?
Their bid was $36,985.25.
Difference of $5.25.
The name of the in charge of that company's name, persons.
That's not, Commissioner, I'm sorry, that's not pertinent to the matter at
It is
hand.
very important.
It is not, Commissioner.
Yes.
You have,
Mr. Chairman. It is a bid. The bid should have the person's name who is applying for it and where it is originated from. We do not want any hidden political or non-political. That is what I'm saying for the public transparency.
That's all public information, Tom. It's in the packet.
I didn't get it.
it was in the finance committee packet. The finance committee recommended this bid.
Mr. Chairman,
Yes.
Finance Committee, Personnel Policy Committees, all committees, they agree or disagree, but they will bring forward to the whole committee, be approved or not to approve. That is what I have been learned. If I am mistaken, please correct. I would like to know the two bids health officer mentioned, who is in charge. It is very important to us because we want to make sure that it is public knowledge. We are not giving, but I don't know what companies are. I'm saying I would like to know who is the first one heading, the second. Why we are hiding?
We are not hiding. It's all public information. That's what we're telling you.
But
We-
if you
Can I have, can the officer read that names? Why not?
My friend, I don't know exactly what the entity structuring is of both of those.
Mr. Chairman, I am asking the health
But
officer.
commissioners, this is a time for the members of this board to debate. We have a motion on the floor. This is between us as members of the body, not between us and staff people. If you wanted to know who the owners of these companies were, there is a site in the state of Michigan. You can go publicly to that website and find out who the owners of that business
Mr.
are.
Chairman,
Let me stop you. Rebecca, do you have that information at your fingertips?
Nicholas Lytle was the individual who submitted the bid for N&L. And I'm trying to locate the name of the individual who submitted for Apex. I did not bring it with me.
Is that a part of the finance committee packet that we received?
I don't
Is that
see it
everything?
in
I
there.
don't think it doesn't list it lists the business name and the business address.
So if I may, Mr. Chair,
Yes, sir.
what I have one problem with is that we didn't get 3 bids. We're supposed to have 3 bids according to policy. So that's the first part. We're not following policy because we didn't get 3 bids. Now, because the third person didn't get back with you, doesn't qualify that as a bid going out.
Well, I mean, we
You reached out to them, they,
agreed to bid and then he never followed through,
okay, so that doesn't qualify as a bid for us to look at.
correct? It's not.
Okay, so that's not following procedure. The other thing that I'm a little bit disturbed about, I know we passed this through the finance committee, but having gone over this, I see 2 completely different bids, okay? And the problem that I have with this is one is itemized very nicely, the other one is not itemized at all. So when I'm looking at a bid, I think, in my humble opinion, that when we do a bid like this, we need to have our own form to fill out. Send that form to the company that we're requesting a bid from. So every company is on the same form. Now, for instance, I'll detail this just a little bit. We have, for the ceilings, we have 7,701 square feet. Okay, and that's what they're bidding on for the ceiling. So everybody understands, nobody's going in and taking their own measurements. Nobody's going in and saying, well, we're gonna use 10 gallons or we're gonna use 15 gallons. What we do is basically summarize what we need as a bid and put it out that way. So the companies, again, that bid on this are all bidding apples to apples. And that way we know who's gonna be doing what and what it's gonna cost us itemized wise. And if we have our own form to fill out, that takes away any idea that there might be somebody hiding something or somebody getting an advantage over someone else. So these companies would then fill out our form with their names and their date. And the other thing that I have an issue with on these 2 quotes, neither one of them have 30-day, 60-day quote on this, okay? So if this quote, for instance, was done 11/29/23, so we're going on 90 days past that. In my business, and I know it's my business different than anybody else, when I do a quote for something, I do 30 days or that's it, you know? Because things can change in the marketplace and the industry. So for them to say that this quote is good for a year right now, they'd be cutting their own throat. I mean, in my position. So if we put together a form to fill out for a quote, everybody's on the same page, we know it's all good for 30 days, there's nothing that's not disclosed, everything's in the open for the public to see one way or another. We have 3 bids completed to follow the policy and procedure, so we don't get in trouble there. That's where I'm at.
Thank you for that feedback. Rebecca, can you walk us just real quickly through the RFP process?
Sure. So, the name of the Apex owner is Warren Fick. So we now have both names. The agency, has never been asked to have a form for a bid. So this is a new request, okay? So what happened was, review of contractors, phone calls to contractors. The reason that I reached out to the contractor that didn't end up following through was that he had done painting in that building for us in the MCDC suite a few months ago or a year ago, in advance of them reopening. So he'd already been on site, familiar with the building, expected that he would follow through with the bid. He did not, so I was surprised and disappointed, but these individuals were contacted, they agreed to meet. We met on site at the building. I explained the process to them, that it goes through a committee review first, and that the committee then will make a recommendation or not. In this case, the committee reviewed, a recommendation was made, it's brought to this group at this point, and I explained to them that should that occur, the Board of Health would then as a whole, review it, and in most cases, usually, it's approved. So that is the process.
Okay.
If I may, this body has in the past approved similar bids where we've only been able to get maybe even one bid. You know, you can reach out to all the contractors you want, but if they're not gonna give you a bid, they can't make up a bid, and we can't wait to act on the bids that we do have.
All they gotta do is sign no thank you and turn the form back yet.
Yeah, but I mean, you know,
But Commissioner, we don't have a policy that we require our own bid form. Now, that's something that we're gonna do, that would have to go to the policy committee of the agency first to develop.
And if that's what we need to do, then that's what we need to do, but I don't feel like, you know, these people did come, they did provide bids, they did everything that I asked them to do. And
the one we're recommending is the one, just for clarification, that is the detailed, yeah. So there's not a lot of ambiguity there.
And it was the cheapest
It was a
bid
cheapest.
received,
yes,
and, if accepted, how much money will be left on that grant funding?
The grant is for 135,000, and we have scheduled this as part of that.
And that's the only first part. So there's
Now, no,
there was,
the water, the drinking fountains were part of that as well.
Yeah, okay.
don't know that we've got all the bills in for that yet.
No, we don't. And we didn't specify when we wrote the grant because we had such a short time to turn around the grant itself. What we specified was that we were going to do painting and carpet in some of our offices. We didn't specify how much or which office specifically. We did target the Three Rivers and the Hillsdale office in the grant most appropriately because they were the oldest. But we didn't know because we hadn't gotten any recent, I mean, everything's gone up. So we hadn't had any recent bids to identify, well, we're going to spend 50,000 on painting or 20,000. We didn't know. So we left it very general and the state accepted it.
Very good. Okay. Well, I'll call the question. We have a motion on the floor to accept the bid by Apex Painting. All in favor with an aye.
We'll call it.
Let's do a roll call.
Commissioner Matthew?
Under these circumstances, 36,440 and 36,985, no.
Commissioner Hoffmaster?
Yes.
Commissioner Leininger?
Yeah,
Commissioner Lane, yes.
Motion fails for lack of a majority. So I would assume that we can bring this back with maybe a letter signed by the third party saying that they don't want to bid. Would that help out with the? So we'll move on. All right. Audit. Ms. Rebecca.
Well, you have the annual letter in your packet. And this is mostly a formality explaining that they are getting ready to come visit and do the audit. Teresa, anything more?
No, just my team's been working really hard to get ready for that audit and we expect them to be on site on Monday.
Okay. Very good. Good luck with that.
As a reminder, Teresa, how long is our contract with them good for the audit?
I believe this is our last year, or maybe next year. I'm not sure. I'll have to look. Let me double check.
All right, moving on to G, Board of Health Education session. Requesting feedback.
Yep, we just wanted to ask if you had any particular topics that you wanted us to be focused on. So, the Area Agency on Aging is today. As Paul mentioned, we're gonna talk about the food program next month. Is there anything that you would like us to focus on? If you don't, necessarily have an answer today, that's fine. You can let us know, later today, but we do wanna ask for your feedback on what you'd like to hear.
Very good. We'll make sure you get staff feedback.
Okay.
Sound good?
Sounds good.
All right, very good. On to number 10, public comments. Doesn't look like we have a lot of public, so open it to public comments. Seeing none, we'll close public comment.
Mr. Chair,
Yes, sir.
I make a motion to adjourn.
Okay, we have a motion for adjournment. Any support?
I was
We have motion and support. Further discussion?
Not
Thank you.
debatable.
Oh, non-debatable. All right. All in favor, then aye. All opposed, the same.
You.
Stick around for